Hello all, myself Murshida Yasmin, Assistant Professor from SNS College of Physiotherapy. Today I am going to talk about a neurological condition called Syringomyelia. Syringomyelia is a syrinx, that is a cavity that present inside the spinal cord. That cavity may contain some amount of cerebrospinal fluid in it. That is called as syringomyelia. It typically present in cervical and thoracic region of the spine. It can extend over the time. The syrinx, that is the cavity that present in the spinal cord, compresses the nerve fiber and can also damage the nerve fiber that is related to the syrinx. This can lead to sensory deficit, motor deficit, and also autonomic dysfunction of the human body. Etiology. What are the common causes that lead to syringomyelia? Chiari malformation type 1 can be the primary cause of syringomyelia. That is, in this picture, you can see the normal anatomical structure of the cerebellum that present above the foramen magnum. In Chiari malformation, the cerebellum will descend downwards the foramen magnum. So this obstructs the cerebrospinal fluid flow. It is the most common causes, and over 50% of the cases with syringomyelia is because of the Chiari malformation. The other cause can be post-traumatic syringomyelia. Any trauma to the region of the spine or the region that present between the cerebellum and the spine can cause the syringomyelia. That accounts for post-traumatic syringomyelia. It occurs some years after the spinal cord injury. It affects about 5 to 10% of the spinal cord injury patients. The other cause of the syringomyelia can be a spinal cord tumor. So this picture shows you the spinal cord tumor that compresses the spinal cord. So mostly intramedullary tumor that blocks the cerebrospinal fluid flow. This leads to syrinx formation in the spinal cord. The other cause can be the spinal arachnoiditis. In this picture, you can see the normal spinal meninges with the arachnoid matter intact. Here. In this picture, you can see the inflamed arachnoid matter. So because of the inflammation, the scarring of the arachnoid membrane can obstruct the cerebrospinal fluid. This may lead to the fluid accumulation in the spinal cord, and that can lead to the cause of the syringomyelia. So these are the common causes of the syringomyelia. The next is the pathophysiology. How the syrinx formation happen and how the expansion of the syrinx happen. So the first is the cerebrospinal fluid obstruction. So the flow has to be in continuation. Once the flow obstruct, the obstruction impedes the normal cerebrospinal fluid circulation. That will lead to intramedullary fluid accumulation. So the pressure differentiates, forces the cerebrospinal fluid into the spinal cord so that the cerebrospinal fluid enters the spinal cord. So this causes the syrinx formation. The syrinx will expand over time and the cyst gets enlarges. That will lead to compression of the white and grey matter of the spinal cord. Once the compression occurs, the compression will destruct the or destroy the nerve fibers which are related to it. That nerve fiber damage will cause the pain and temperature sensation in exaggeration. So motor neurons can also be affected. Finally, it leads to ischemia and neurodegeneration. So chronic compression of the spinal cord leads to tissue death at that area. So that ischemia happens and finally the neurodegeneration happens. So this is the step-by-step pathophysiology about the syringomyelia. What are the clinical features we can expect as a diverse symptoms of the syringomyelia? So sensory deficits, which includes bilateral loss of pain and temperature sensation in the affected area, and the classic cape distribution can be seen in the sensory deficit. Numbness is also common, and in motor weakness, the weakness will be progressive in nature. Atrophy in hands and arms will be seen in the severe state, and spasticity in legs can be seen in common in syringomyelia cases. Pain, which is basically chronic neuropathic pain, is often severe and it's located at the neck, shoulder, and the limbs which are related to the syringomyelia. The next is the autonomic dysfunction. We can expect it as a bowel and bladder issue. Sweating abnormalities will be there, and impotence may also occur in the syringomyelia cases. The involvement of spinothalamic tract causes the pressure, pain, temperature, and crude touch sensation, which get majorly affected. The loss of sensation, like cape-like distribution, and the scoliosis can be expected. The Charcot joints symptoms can be seen in the syringomyelia. How we can diagnose the syringomyelia? Neurological examination. We have to assess the sensory, motor, reflex assessment of the affected area and also the normal area. And the cerebellar function can be examined with the help of cerebellar assessment of balance and coordination. And MRI is a gold standard for visualizing syrinx and Chiari malformation and tumors which are present in the spinal cord. And the cerebrospinal flow studies can be done, SIGN MRI, which evaluates the CSF movement around the craniocervical junction. Next, EMG and nerve conduction can be done on the affected area, which assesses the nerve and muscle damage. Finally, the somatosensory evoked potential, SSEPs. This measures the nerve signal conduction speed, how the affected nerve is potential to conduct a sensory or motor impulses. So that can be assessed with the help of SSEP. So these are the interventions we can use to identify the common causes and also the present state of the patient. How we can use a physiotherapy to treat and also to assess the patient. In assessment, we have to evaluate the pain with the help of visual analog scale or numerical pain rating scale. And strength assessment has to be done with the help of manual muscle testing. Range of motion has to be assessed with the help of goniometer. Balance should be assessed with the help of Berg balance scale and time up and go test. Functional independence with the help of functional independence measure and Barthel index. These kind of scales will help us to come to a clear conclusion about the present clinical state and present functional state of the patient. Next, we have to reduce the pain. That will be the primary goal of our physiotherapy treatment. So, decreasing the spasticity will help you to reduce the pain. And also, we need to improve the independence of the patient and maintain and improving the functional independence, and so that the functional independence score will get improved. And finally, we have to prevent the complication so that we can avoid the contractures and skin breakdowns through a proper monitoring and proper positioning, and the reduction of spasticity and increasing in range of motion will reduce the contractures and skin breakdowns. So we have to optimize the quality of life. Improving the quality of life score, SF36 score can be used to assess that, and also we need to give a better quality of life to the patient. What are the interventions we can incorporate in syringomyelia cases? Pain management with the help of TENS, hot and cold therapy, manual therapy, postural education exercise. These all should be incorporated in a regular protocol session so that the pain management can be done effectively. Strength and endurance training, progressive resistance exercise with the low impact aerobics can be given for the improvement in strength and endurance. Flexibility and range of motion exercise to ensure that all the muscles are gently stretched, and passive active assisted exercise can be incorporated in the treatment protocol. Balance and gait training, once the patient gets relief from the pain and once we can achieve good strength and flexibility, we can go for the balance and gait training. Proprioceptive exercises, assistive devices can be helpful, like walkers, canes. These can be given to the patient as an assistive device. Spasticity management, stretching, positioning, hydrotherapy, serial casting of a particular muscle which is over tightened, so that the spasticity management will be helpful by following these kind of protocol. Respiratory therapy, of course, it is important to maintain a patterned breathing in the patient with the help of diaphragmatic breathing exercise. Airway clearance technique should be taught to the patient to give a good respiratory hygiene. So these step-by-step protocol intervention can be incorporated to the syringomyelia cases according to the need of the patient and according to the severity of the patient, of course, on the basis of the assessment. Complications of the syringomyelia, progressive neurological symptoms can be expected, like worsening of the weakness, sensory loss, and loss of fine motor skills can be, and severe chronic pain, which is difficulty to manage, and that will significantly impact the quality of life. Deformity we can expect, of course, with the severe scoliosis, and if we did not address the joint range of motion properly, joint contractures can be expected. Functional impairment, loss of independence in daily activities as the disease progresses. Autonomic dysfunction, cardiac arrhythmia, blood pressure instability, temperature dysregulation. These autonomic dysfunction will give a major impact in the functional impairment in patients' quality of life. Patient education is must. Home program we have to incorporate, and the disease progression, red flag symptoms, and what are the surgical options available to get quality of life. These kind of things we have to educate to the patient. Daily exercise routine, self stretching, energy conservation techniques, home safety modification, balance exercise for fall prevention. These should be taught to the patient as a home program, strictly monitored as a follow up in regular basis. To conclude, syringomyelia is a complex condition. Holistic and interdisciplinary care is crucial. Neurosurgery, physiotherapy, occupational therapy are vital to the patient. So this approach manages the symptoms and preserves the function of the syringomyelia cases. It also optimizes the patient's quality of life. Thank you.